As people age, bones and cartilage that make up the back and neck region submit to wear and tear. Cervical spondylosis is a type of osteoarthritis that affects the intervertebral joints of the neck region. The cartilage of intervertebral discs and the cartilage that lines the joint-facing bodies of vertebrae can degenerate over time. This pressure causes compression, leading to bulging discs. To stabilize the spine, bone spurs called osteophytes often grow from the vertebrae. These changes cause pain and stiffness. The carpal tunnel is the passageway in the wrist where the median nerve and flexor tendons pass through a narrow opening. Repetitive motion, such as typing, can cause carpal tunnel syndrome. Carpal tunnel syndrome occurs when the tendons become inflamed, causing compression of the median nerve. Symptoms include pain, numbness, and eventual weakness in the hand.
The shoulder, elbow, hip, and knee are common locations for bursitis. Bursa are small, fluid-filled sacs that cushion the bones, tendons, and muscles near your joints. This condition often occurs near joints that perform frequent repetitive motion. The hip, for example, is a common site for bursitis. Bursitis occurs when bursa become red and inflamed, causing pain. The rotator cuff is a group of muscles and tendons that surround the shoulder joint. These muscles keep the top of the upper arm in the shoulder socket by forming a cuff that not only holds the arm in place, but helps it move in various directions. Gradual degeneration due to repetitive overhead motion or a sudden traumatic event can tear one of the muscles or tendons of the rotator cuff. Symptoms of this injury include pain, decreased range of motion in the shoulder, and muscle weakness. Lateral epicondylitis affects the muscles of the forearm that join on the lateral side or outside of the elbow. This condition is also called tennis elbow because the repetitive strain of these muscles is commonly seen in patients who play a lot of tennis or other racket sports. Overuse of these muscles can cause damage. As a result, micro tears may develop in the tendons, causing inflammation and pain. This pain and tenderness is felt on the outside of the elbow.
The lumbar spine bears the weight and stress of the body. As a result, disc herniations can occur, which affect spinal nerves. The sciatic nerve, which starts at the lower back and travels down the back of the leg, is often affected. When a disc herniates, it can pinch the nerve. This is a common cause of sciatica. Sciatica typically affects one side of the body with mild to severe pain, muscle weakness, or numbness felt anywhere along the nerve pathway. The plantar fascia is a thick band of connective tissue that runs along the bottom of the foot, connecting the heel bone to the toes. Activities such as running or dancing can repeatedly pound the feet on hard surfaces or put too much tension on the plantar fascia. This can result in micro tears of the ligament, which lead to irritation, inflammation, and pain, called plantar fasciitis.